Welcome to the Back Talk Podcast, where we talk about your back so it doesn't talk back to you. Hosted by Dr. Peter Peduzzi, Clinic Director at American Back Centers. Each episode explores real solutions for back pain using non-invasive, non-surgical care designed to help you avoid spinal surgery. Helping people throughout the greater Pittsburgh area feel better naturally, without the hardware or the drama.
Stress doesn't just live in your mind. Today, we're uncovering how it shows up in your muscles and your back. Welcome, everyone. I'm Julie Schwenzer, co-host and producer in the studio with Dr. Peter Peduzzi, Clinic Director at American Back Centers. Dr. Peduzzi, thank you again for joining us. We always appreciate your insight.
Thank you for having me.
So, let's talk about stress. You did mention it in the last episode, how it definitely can affect chronic back pain. How does it affect back pain physically and muscle tension?
Stress can accumulate, as I mentioned in the last segment, over time. All the things that go into life, emotional, chemical stresses from the foods we eat, diet, poor diet, lack of exercise, all these traumas. If you were in sports in high school, college, car accidents, work related injuries, all these slip and falls over the years, all these micro traumas add up over time and contribute to overall stress overload or stress in general to the body, which can lead to problems, injuries.
And can we reverse the damage that stress caused? And particularly the point you brought up about, particular foods.
Yeah, definitely a better diet, anti-inflammatory diet, eating better, less stress on the body per se. Overall, handling stress, dealing with stress throughout personal reasons, as well as, just avoiding the wear and tear on the body with all the things that go into life and the things that we do. Prolonged sitting, as I mentioned, changing positions throughout the day. Prolonged postures really cause a problem with the entire spine, whether it's the neck, mid back, lower back, just changing positions throughout the day and not staying in one posture, staring at a computer, staring at a cell phone. All of these things add up, as we know.
Have you seen a big difference in posture with the onset of like cell phone use? And I know maybe that's way before you probably maybe you're younger in your profession, but I was just curious about that with like the people using devices all the time, nonstop before bed. Do you see a big difference, or have you studied that there was a big difference in people's posture?
Oh, for sure. I mean, we see it. More and more people are getting the rounded shoulder, forward head posture. So we address that with the therapy and rehab we do here, strengthening those weakened areas that are inhibited and weak because we're constantly putting our body into those postures, and then stretching some of the overly tight, overly used areas to bring all that back. Because you can do all the greatest treatments in the world to the neck, the mid back, lower back, but if you don't address those postural issues that are slowly but surely manifesting in the body, then none of the treatments are going to hold. So it's very important that we incorporate the rehab with the treatments to open up the spine. And that's what we do here at the American Back Centers.
And what about someone who might be in that like fight or flight response, that type of lifestyle? How does that impact muscles too along the spine?
Well, the constant overload, that fight or flight, that sympathetic nervous system can cause a lot of undue stress in the body, which can cause muscles to tighten up, stress, chronic inflammation in the body, just overload of the body, stress per se, which can cause, like I said, the muscles to tighten, spasm, and pain processes throughout the body.
Is pain one of the earliest signs that stress is really getting to you and that pain in the back?
Yeah, the body, when there's a problem, there's pain messages sent to and from the brain, and then we also have muscle guarding. The body tries to protect itself very well by guarding the area, and we take muscle relaxants and pain pills to kind of suppress that. That's not really the solution in many cases. It may let you sleep at night per se, but the long-term solution should not be that suppressing those natural mechanisms, because the structural problems continue to occur, whether it's degeneration, bone spurs, compression of the spine, and all that just gets worse. And you're just covering it up.
And then what about breathing patterns? How does poor breathing hurt you? Like with your muscles, with stress too?
Yeah, I mean, poor breathing, we teach our patients to breathe properly to allow the body to relax. And with that, it allows the muscles to relax so they're not tensing up and you're not, again, as you mentioned, contributing to that fight or flight of the body, which just makes everything more pronounced in the body, stress wise.
And what about some other behaviors like clenching or, guarding? And how does that affect your back pain over time?
Well, clench and guarding, it definitely can cause more problems by causing the muscles to grip more as well. But just, general relaxation techniques we teach our patients, whether it's meditation or just general relaxation of the body, um, is very important to help relax the body. We also recommend some supplements that can help naturally relax the smooth muscle tissue, which can help with stress as well.
And then how does non-surgical care help break the cycle between stress and chronic tension?
So the non-surgical care that we have here is very obviously non-invasive, non-surgical. That helps to when we relieve the compression on the spine and the nerve compression, the body's mechanism of protection, that natural muscle spasm and pain messages to and from the brain, stop occurring slowly but surely because the problem is improving. So the body doesn't have to protect the area as much anymore. So we're actually addressing the true cause of the problem. So true healing can occur, not just putting a band-aid on the problem.
How many times have patients come in and immediately felt less stressed because you offer them solutions where they don't have to go into surgery? Probably every time. Surgery is
Every
scary.
day, every day we see that, and patients are just, remarking on how much better they feel, they're sleeping better, and they have their life back again. That's the most important thing. They don't have to deal with constant pain and, overall tension in the body because they're feeling much, much better.
And for those suffering with the stress and the pain, what is a first small step that you could recommend for them to start feeling better? And I know you mentioned, in previous episodes and earlier in this one, what we can do, but just a great reminder to everybody to help feeling relief now. How do we do it?
Well, the best thing you can do is obviously exercise and try to get up and move around, especially throughout the day. You can come to our office and get a consultation to see if we can help you with our non-invasive, non-surgical treatments. Our goal is to help people avoid spinal surgery at all costs because there's many potential complications that can involve with that. In any invasive procedure, we want to avoid the band-aids too, the pain medication, the epidural injections that simply don't solve the problem and you want a true solution to the problem, we offer that here at the American Back Center.
Okay, well, Dr. Peduzzi, thank you again for shedding light on such an important topic and connection between stress and pain.
Well, thank you very much.
Thanks for listening to the Back Talk Podcast. If back pain is slowing you down or bossing you around, it may be time for a natural approach that works. Call 724-935-3300 to schedule a consultation with one of the doctors at American Back Centers or visit AmericanBackCenters.com.
At American Back Centers, you've got nothing to lose but the pain.